Is cataract surgery covered by Medicare? The answer is, and before I answer that, I'm Duncan, and I'm making today's video from a conference room at the American Express Centurion Lounge at the Dallas-Fort Worth Airport. I finished a conference on digital marketing in Austin yesterday, and I'm traveling to Charleston, South Carolina right now. We had some weather in Austin, and I missed my connecting flight to Charleston here in Dallas. So I have a few hours, and I'm always trying to utilize my time. If you haven't seen any of my other videos, I'm an independent insurance broker, and I specialize in Medicare Explained, and also helping with other products specific to seniors. I help compare Medicare plans for Medicare supplements, Medicare Advantage, Part D, in addition, dental, vision, hearing insurance, cancer insurance, protecting retirees, retirement savings, and more. If you'd like to contact me, the easiest way is to call me toll-free at 800-910-3382. And if you like this video, please give the video a like and subscribe to my YouTube channel. So the quick answer, if Medicare covers cataract surgery, and the answer is yes. But there are costs you will be responsible for. While doing research on this subject, I learned a few things about cataracts. And don't forget, you can see my other blog posts about other Medicare related subjects. The link to the blog posts and webpage are in the description. Cataract surgery is considered a Medicare Part B service, and Medicare will pay 80% of your cataract surgery after you fulfill the very small Part B annual deductible. If you have seen other videos, the Medicare Part B deductible in 2021 is $203. If you're watching this video after 2021, the Part B deductible is very likely to be a little bit higher. So Medicare can help. Medicare will pay 80%. This is great, but you're responsible to pay the other 20% that Medicare doesn't pay. I hope you can't hear all the dishes clanging outside. I'll know more when I edit this video, and I'll probably set this video to some music as well, hopefully drown it out. Usually this microphone does a pretty good job. However, this is where I come in as an independent agent. I help people just like you every day find the exact right Medicare supplement plan that will pay the other 20% Medicare doesn't pay for. Remember that the Medicare supplement plan letter you pick, like Plan G and N, those are our two most popular plans. But also Medicare dictates that every company must have the exact same benefits for the letter plan you are looking at. And it states on page 9 of the guide to buying a Medigap policy, cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. What this means is, if you buy a Plan G with one company, you know the benefits, doctors, etc. And there goes that thing up there. I don't know what that is, but that makes some noise about every 90 seconds or so. But what you know is the benefits, doctors, etc. will be the exact same in price, and price will be the only difference. I hope those new to Medicare find the best Medicare supplement plan for their needs with the best company and with a competitive price. Many inexperienced agents and those working in giant call centers advise their clients just to get the cheapest price because the plans are all the same. And while the plans are the same, the companies that sell the Medicare supplement can be very different. You should be looking for a reputable company and a company that has a history of stable rates. Many times Medicare supplement companies will offer low rates to entice you to buy, and they will also offer agents bonuses to sell their product. While the company may have good rates for a few years, there is a likelihood of rate increases in the future. Now, all companies, they have rate increases every year. What you want is a company that has experience in the Medicare supplement space and knows how to price their product competitively, but also know how to manage their business to provide profits for their company and stable rates with good customer service. This is why we are independent, because we get to represent many different companies all at the same time and compare what is exactly right for you. We represent companies like United Healthcare, Aetna, Manhattan Life, Humana, Cigna, Blue Cross, Blue Shield, Anthem, and the list is just too long to finish. The reason we offer so many great companies is we do business from coast to coast, and United Healthcare might have a great price Plan G in California, but maybe not so in Illinois. Or Aetna may have a great price in Illinois, and maybe Cigna is better in Pennsylvania. All these companies I mentioned are our core companies and have been in the Medicare space for a long time and have good reputations. What we are able to do is compare all the prices from our core companies and all the other companies as well to make sure you're getting the best program for your exact needs. Here's a little more about what I learned about cataracts. Cataract surgery is normally performed, as you know, in a doctor's office or in a hospital. It's an outpatient procedure. You can go home after undergoing surgery. Cataracts, they cloud the eye's lens, and it happens to affect vision, obviously. Usually cataracts form slowly, so when cataracts start blocking light is when many people notice they are forming. After a long time, things start to look blurry, hazy, or less colorful. Problems start usually with reading and other everyday activities when cataracts start to form. About half of the people between age 65 and 74 are affected by their vision due to cataracts. Exposure to sunlight may increase the risk of having cataracts in the long term. Also, if you smoke and have diabetes. In accordance to the National Eye Institute, almost half of all Americans will either have cataracts or have had cataract surgery by the age of 70, and a link is provided in the description to the National Eye Institute. Now, if you keep your original Medicare Part A and B, like I mentioned, Medicare will cover 80% and you will be responsible for the other 20%. But you can purchase a Medicare supplement from a private insurance company to pay the 20% that Medicare doesn't pay for. Finding you the best Medicare supplement for your needs is where I come in and how I make my living with my business. To learn more about Medicare Part B, you should be seeing a card in the upper right-hand corner right here that will take you to my video on Medicare Part B. There is also a link in the description below that will take you to the website I have made. So how does a Medicare Advantage plan differ from original Medicare? Private insurance companies, they offer the Medicare Advantage plans. It's an association of Part A and Part B benefits. Depending on your Medicare Advantage plan, the costs, they're going to vary. Medicare Advantage plans has some very different rules as opposed to original Medicare. If you've seen my other videos, you know I tell you there are a lot of agents making videos about Medicare Advantage that just bash Medicare Advantage. While Medicare Advantage has a lot of disadvantages to original Medicare, it also has a lot of advantages over original Medicare. I've chosen to become an expert in both arenas so I can help you the best. Depending on the Medicare Advantage plan you have, you will be responsible maybe for a deductible and a copay. Most of the Medicare Advantage plans we provide have a $0 health deductible and also a copay for the cataract surgery. Usually it's around $100 or $200, but some of the plans we represent, they actually have a $0 copay for the surgery. It just depends on what area of the country you live in and what plans are available. Again, it is my business to help you find the plan that is best for you. One of the major disadvantages of Medicare Advantage, in my opinion, is the potential of restrictive HMO doctor networks. You must use this doctor network in order to have coverage. With an HMO, and most of our clients that get a Medicare Advantage choose to get an HMO because in general they have the lowest costs. You need to use the referral system. You must see your primary care doctor and they will refer you to a specialist. And to be fair, there are more HMO plans than there have been in the past that are allowing you to self-refer to a specialist. But there are not a lot of those available, at least at the time I'm making this video. There are also PPO plans which allow you a wider network of doctors and specialists to use. And these PPO plans have out-of-network coverage as well. But in general, the PPO plans have higher premiums, deductibles, copays, and out-of-pocket maximums. For more information, again, another card should be appearing right up here if I've edited this video correctly in the upper right-hand corner. And it's going to take you to a video that I've made about Medicare Advantage, and that's also called Part C. In addition, there is a link in the description to the website I've made with this video as well. Let's talk about the eyeglasses. I get this right from Medicare's website. I will provide a link directly to it as well. And it states Medicare doesn't usually cover eyeglasses or contact lenses. I'm sure you know that already. However, Medicare Part B medical insurance helps pay for corrective lenses if you have cataract surgery to implant an intraocular lens. Corrective lenses include one pair of eyeglasses with standard frames, very important, standard frames, or one set of contact lenses. It goes on to state you pay 20% of the Medicare approved amount for corrective lenses after each cataract surgery with an intraocular lens, and the Part B deductible applies. you pay any additional cost for upgraded frames. Medicare will only pay for contact lenses or eyeglasses from a supplier enrolled in Medicare, no matter if you or the supplier submits the claim. What this means is basic eyeglasses are covered after cataract surgery under Medicare Part B. Medicare will pay 80% after you have paid the once per calendar year Part B deductible. Then you're responsible to pay the remaining 20% unless you have the right Medicare supplement plan. Glasses will also be covered with your Medicare Advantage plan, but there may be a copayment you may need to make. You're also responsible for the costs of any upgraded frames, whether you use Medicare Part B or you use a Medicare Advantage. And just a quick reminder, you can't have or use both Medicare Part B and Medicare Advantage. There is more on that in my Medicare Advantage Part C video. Now that's all I have for today's video about Medicare and cataracts. Let's go to my favorite part of the video, and I really wanted that thing to start ringing right now because my favorite part is the quick recap. I usually get a little bit more excited about it, but I don't want to disturb all those people that are out there right now trying to enjoy themselves. But cataract surgery is definitely covered by both Medicare Part B and Medicare Advantage. With Part B, you will be able to have coverage at any doctor that accepts original Medicare, which is over 90% of all providers. If you keep your original Medicare will pay 80%, and you're going to be responsible for the other 20%. You can purchase a Medicare supplement plan, also called a Medigap, to pay the other 20% Medicare doesn't pay. Our two most popular Medicare supplement plans are Medigap Plan G and Medigap Plan N. I have made a video and a blog on the Medicare Supplement Plan G versus Plan N to help you pick which is right for you. You're also eligible for basic glasses after cataract surgery for both original Medicare and Medicare Advantage, but you are subject to the Part B deductible if you haven't already paid it, and the 20% with Medicare Part B. And there is usually some type of copay assigned for the glasses if you have a Medicare Advantage plan. If you get cataract surgery and have a Medicare Advantage plan, you will certainly have coverage, but you will be subject to your plan's deductible and copays. And don't forget, depending on your plan's rules, you will likely need to see a doctor that is inside your plan's network to have coverage if you have a Medicare Advantage plan. Again, I'm Chris Duncan. If you have a question about this or anything else, as you know, I'm here to help. I help with Medicare supplements, Medicare Advantage, Part D prescription plans, dental vision hearing plans, final expense life insurance, also called burial insurance. I help with cancer insurance, protecting retirement savings, and more. If you'd like my help or you're ready to enroll in a plan, it is easiest to contact me toll-free 800-910-3382. If you found this video helpful, please do me a big favor, subscribe to my YouTube channel and like my Facebook page. Thanks for watching, and I'll be seeing you in my next video.